Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's look at the structures passing through the skull foramina. So the first one we are looking at is optic canal. So this optic canal, it transmits optic nerve. So there is optic nerve as well as the ophthalmic arteries. Next is the superior orbital fissure. Under superior orbital fissure, it includes the lacrimal nerve, that is V1, then the frontal nerve, that is V1 again, nasociliary, this is V1, then the cranial nerves 3, 4 and 6, superior ophthalmic vein as well as the inferior ophthalmic vein. Next is the foramen rotundum. The foramen rotundum is the maxillary division of the cranial nerve 5. And then comes the foramen ovale. The foramen ovale, it includes the structure male. So what is male referring to? Male, M stands for the mandibular division of the cranial nerve 5, that is V3. Next is A for accessory meningeal artery, L for the lesser petrosal nerve, and E for the emissary vein. Next we move on to the foramen spinosum. So foramen spinosum, it includes the middle meningeal artery, there is nervus spinosus as well as a middle meningeal vein. Next is the foramen lacerum. Foramen lacerum, it includes a deep petrosal nerve as well as the meningeal branch of the ascending pharyngeal artery, meningeal branch of the ascending pharyngeal artery, as well as the foramen lacerum, it contains the emissary vein. What about the carotid canal and its contents? The carotid canal, we are writing as C canal. The carotid canal, it contains the internal carotid artery as well as the venous and sympathetic plexus. Venous and sympathetic plexus around artery. Then we have the jugular foramen. The jugular foramen is inferior petrosal sinus. Inferior petrosal sinus and the meningeal branch of ascending pharyngeal artery. Meningeal branch of the inferior petrosal sinus, the meningeal branch of ascending pharyngeal artery, then cranial nerves 9, 10 and 11, as well as the sigmoid sinus, sigmoid sinus continuing as IJV, that is the inferior jugular vein. Next there is also the middle meningeal branch, and this is of the occipital artery. Next we move on to the hypoglossal canal. It is a hypoglossal canal. So under this hypoglossal canal, there is the inclusion of the hypoglossal nerve. There is hypoglossal nerve. That is nothing but the cranial nerve 12. Next is the foramen magnum. So in the foramen magnum, there are a lot of structures. Let's look at that. So there is osteoligamentous, which is present in the anterior part. So osteoligamentous, which is present in the anterior part compartment, and this includes the apical ligament. So apical ligament is present, and also the tip of dens, apical ligament and the tip of dens. Next, the structure is upper band of cruciate ligament, upper band of the cruciate ligament, as well as a membranous tectoria. So this was the anterior part and osseous ligamentous compartment. Next is the neurovascular compartment. The neurovascular compartment is nothing but it is known as a posterior compartment. So here, what are the structures? The structures included are the lower end of the medulla oblongata. So lower end of the medulla oblongata. Next is the fourth part of the vertebral artery. And this is surrounded by the sympathetic plexus. Surrounded by the sympathetic plexus of nerves. Next is there is also the spinal roots of accessory nerves. The spinal roots or the accessory nerves, and the anterior and posterior spiral arteries. Anterior and the posterior spiral arteries. Next is also the tonsil of cerebellum. Tonsil of the cerebellum. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.